The provincial government says all long-term care homes in Ontario now have air conditioning in some capacity after new regulations came into effect earlier this month. But 40% of homes still do not have AC in resident rooms, leaving critics demanding more be done to keep seniors comfortable and safe this summer. Kelly Botello has the details.
In April, the Ford government updated regulations to the Long-Term Care Act, requiring all homes to have at minimum designated cooling areas in common spaces. The homes had until May 15th to make sure they had some form of AC.
All 626 long-term care homes, all 626 homes have informed us that they are in compliance.
In comparison, the Ford government says last year, 13% of long-term care homes had no air conditioning at all. But long-term care advocates aren't impressed because only 60% of homes have AC in resident rooms where seniors spend the most time.
Those rooms become ovens, and that can be deadly for older adults who already have a higher incidence of dehydration.
Long-term care advocate Dr. Vivian Stamatopoulos says only being required to cool common areas is especially problematic during a pandemic.
We don't have the staff to actually take these residents into the common areas. And frankly, if there's even two cases, an outbreak, so to speak, residents are then confined in their rooms.
NDP leader Andrea Horvath says air conditioning is not that complicated and should be a basic necessity in these facilities.
It's still not good enough. Many seniors in long-term care will still be stuck in sweltering rooms, fading away over the summer.
Long-term care minister Merrilee Fullerton says an additional 23% of homes are currently working on having air conditioning throughout the entire building.
This means that at least 83% of homes will have full air conditioning by this summer.
Advocates say it can't be done soon enough. Kelly Botello, CHCH News.